I'd like to call the HHS meeting to order. And let's see, we do have a physical forum, yes?
No.
No?
Only 3.
Okay.
Oh, no.
All right, so in that case, physical forum is not present. Section 70 of OMA permits members to attend remotely. We do have a member official or council present at our regular meeting location. In-person attendance and public comment are allowed, subject to attendance limitations to ensure health and safety of those who attend. So all of our votes are going to be roll call votes. Roll call, please.
Chair Runahan,
Here.
Vice Chair Swarzy,
Sure.
Member Selman,
Here.
Member Chaplin,
Here.
Member Desart,
Here.
Member LaPlante.
Thank you. I'm sorry, I always think of Paula as being on the committee because she's here every single time. Thank you. So do we have any public comment?
No public comment.
Okay. All right. So welcome back, everyone. Hope you had a good holiday. I just want to make sure we mark our calendars for the community services ARPA rollout that we're going to be hearing on August 10th at finance meeting. So that'll be very important for us. I had a great time at the Care Center golf outing. We had Liz was there and Vice Chair Schwarzy was there. And I got to tell you, the DuPage County women represented, Mary Keating, Sarah Hahn, Wendy Wagner can seriously hit the ball. So, and then our team of Schwarzy, Chaplin, Renahan attended. We had fun. Also present. Yeah. We had a great time. You know, we really did have a great time, all for a great cause, right? And it was a nice day. We had a little rain, but otherwise very good. And thank you, Vice Chair Schwarzy, for some closing remarks at dinner there. I appreciate that. So with that, I will entertain a motion to approve minutes.
So
Second.
All right, questions, additions? All right, roll call, please.
Member Schwarzy.
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Member Runahan,
Aye.
Chair Runahan, I'm sorry.
We good?
Yes.
All right, I'll request a motion to approve FIR 34021 and acceptance and appropriation of CDBG grant $6,688. Oh, I'm sorry, $6,688,051 for community services. All right, questions, comments? Roll call, please.
Member Schwarzy,
aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Chair Runahan.
Aye, that's approved. I'll take a motion to approve FIR 34121, an extension of LIHEAP IGA through September 30th, 2021 for community services.
Second.
Questions, comments? Roll call, please.
Member Chaplin,
Aye.
Member Desart,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Chair Runahan.
Aye. That's approved. I'll take a motion FIR 34221, a resolution, Illinois Department of Human Services supported housing program, $296,416.
So second.
Questions, comments? Roll call, please.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Chair Runahan.
Aye. All right, that is approved. Entertain a motion on HHSP 31821, DuPage Federation on Human Services Reform Language Access Resource Center for face-to-face telephonic interpreter services, translation, American Sign Language for community services, primarily the Senior Services Unit, August 13, 2021 through August 12, 2022, not to exceed.
So moved.
Second. And Chaplin, roll call, please.
Member Desart,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Chair Runahan.
Aye. That's approved. Take a motion on 2021-65 recommendation with CDWG for monitors, headsets, cameras, pro printer, docking station, docks, laptops for community services not to exceed $21,694.69. It is a CSBG grant funded item.
So moved.
Second.
Questions, comments? All right, roll call, please.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Chair Runahan.
Aye. That is approved. Moving on to care center requests. Take a motion, HHSP 31921. It's a contract with Jorns Healthcare LLC for rental of Dolphin Fluid Immersion Simulation Mattress System, August 9, 2021 through August 8, 2022, not to exceed 30,000.
So moved.
Second.
Questions, comments, discussion? Roll call, please.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Chair Renahan.
Aye. Take a motion on 2021-66. Also approval contract with Jones Healthcare for replacement bed parts for the care center, August 7, 2021 through August 6, 2022, not to exceed $16,897.73.
So moved.
Second.
Questions, comments? Thank you. Roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Renahan.
Aye. That's approved. Entertain a motion on budget transfers. ILD CEO grant modification to LIHEAP. The original grant budget has been modified in order to spend 100% of the grant funding by grant term ending 9/30/21. $320,798.
So moved.
Second.
Any questions, comments? All right.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Chair Renahan.
Hi. All right, that's approved. We have one travel request for overnight travel. Information and Referral Administrator as Chair of IBCA Board to Springfield, July 12, 2021 through July 14, 2022 for about $580.
So moved.
Second.
Questions, comments? All right, roll call.
Member
Um,
Schwarzy.
Aye.
Oh, I'm sorry, member to start.
I was just going to make fun. You said July 12th, 2021 to July 14th, 2022, and it's 2021. That would be a long trip.
Sorry, it's a lot of reading. All right, thank you for that correction. July 12th, 2021 through July 4th, 2021 as well. All right, I'll take a roll call, please.
Okay, Member Schwarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Chair Renahan.
Aye. All right, I'll take a motion to receive and place on file informational item GPN 5221, LIHEAP, $8,482,200, community services.
So moved.
Second.
Roll call.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Chair Renahan.
Aye. All right, those are placed on file. We do have one residency waiver.
Good morning. This is Anita Rajagopal sitting in for Janelle Chadwick. How's everyone today?
Good, thank you.
Thank you.
Good. The one residency waiver. We currently have nine male and 19 female beds available at the center. 5 beds have already been offered to DuPage County residents. There are no DuPage County residents being displaced by this applicant. The applicant is a 75-year-old male, has never lived in DuPage County, but the daughter has lived in the county in Glen Ellen since 2009 and wants her dad closer to home and states that she wants her dad to have the best care, which can be provided here at the care center. So we are requesting a residency waiver for this applicant.
All right, thank you for that. Well, I'll entertain a motion to approve the residency waiver
So
as
moved.
presented. All right, great. Any discussion on this? All right, great. If we can offer a bed, I think, that's great. We're coming back slowly but surely. Great, roll call, please.
Member Schwarzy.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Did I get, okay. And Member Selman, did I miss you?
Yeah. Aye.
I'm sorry.
No
Okay,
worries.
and Chair Renahan.
Aye. All right, that one's approved. DuPage Care Center update.
So we are currently in our survey window. So we continue to prepare and get ready for this. Our focus, really, there's a heavy focus on infection control. So that is what we're doing. We are in the process of educating, auditing, re-educating, and we will shortly do a mock survey just to make sure that all the staff is following the infection control protocol. And this is essentially because of COVID. There's been lots of new information and new regulations that have come down regarding that. So we are focusing on that. As you are aware, we have gradually loosened our visitation requirements while following the IDPH guidelines. We are also keeping an eye on the infection rates in the community, especially the new variant. So that's something that we're taking very seriously. So we are going slowly as we loosen our visitation. The other thing we're also continuing to do, and this is also a requirement per IDPH, is we are testing unvaccinated individuals once a month. And we're also required to educate the same individual, staff and residents alike. So we are continuing to do that also. We also have to submit vaccination data and COVID infection rates data to the National Health and Safety Network, and that's connected to the CDC. So we continue to do that too. Apart from that, I don't have anything else unless there are questions.
Do we have any update on the CNA program and how that's going?
I think that's going well. We have, I want to say 2 or 3 more weeks of training.
All right, great.
So we'll give you an update once we have graduates.
All right, sounds good. Any other questions, discussion from the committee? All right, thank you very much.
Thank you.
Great. All right, moving on to community services update. Mary Keating.
Good morning. I hope everyone had a good 4th. I just had a couple things I wanted to mention. On the agenda, early on in the agenda was the CDBG CV acceptance and appropriation. That's good news. It means we've worked through the whole approval process with HUD. They finally sent us our grant agreements, and now we can move forward with the contracts with the nonprofit organizations. The informational item on LIHEAP at $8.4 million. That's about 4 times what we typically get in an annual basis. This is a 1-year grant program, so it's going to take quite a yeoman's task to get this spent. We're looking at partnering with townships or other nonprofit organizations to take LIHEAP applications. Many of them have taken LIHEAP applications without any sort of remuneration from us. So we did build into the budget to do sort of a per application process to hopefully encourage townships and nonprofits who, as I said, in the past have taken LIHEAP applications. We really are hoping to encourage them to take more. So we'll be rolling that out probably in August. We, in addition, will need to be hiring a significant number of people, figuring out where they're going to sit, frankly. So, you know, this is just one of the many challenges that we're facing with all of this funding that we're getting from the federal government. My general fund budget was submitted to finance last week. So, in addition to the August 10th presentation to finance that I'll be doing about my ARPA requests, and on August 3rd at this committee, I'll just be reviewing my general fund budget. And finally, we continue to wait on the state for our information on the rollout of the water bill assistance program. They haven't decided if they're going to run it through this, basically the CSBG database system or the LIHEAP database system. The water bill system is significantly more complicated because of the number of water providers. I think in DuPage County, there's 45 or 50 or 60 different water providers. So unlike LIHEAP, where we're either paying ComEd or NICOR, the state has to have a process whereby we can pay any of those vendors. We anticipate, we're kind of speculating we'll get maybe up to $2 million for water bills. But again, we're waiting on the state for how they're going to roll that out. And that's all I have.
Any, I think we're in the second phase of the IDA rental assistance, are we now?
Yes, so the IDA, yeah, the second phase, so the initial phase was that the landlord had to initiate the application process, and then the tenants went in and certified and completed their portion. That closed on, I'm going to get my dates wrong, I think that closed on June 9th, and then on June 28th, they call it the tenant portal open. So for tenants whose landlords didn't initiate the process, now tenants can go in and file. I don't think I've gotten any numbers. I've been out of the office for a couple of days, so I need to check and see what we've gotten from the tenant base.
Okay. And if you have anything we can put out to residents too, because this is more resident based than landlord based.
Right,
I think we're
right.
happy
Yeah,
to
we've
do
been
that.
covering it with our social media.
Yeah.
And yes.
All right, just want to make sure.
Are you getting a lot of phone calls on questions on this at all? I mean,
We are not as a department, no, because all the information directs people to call the IDA call center.
oh, okay.
So if we do get calls, we're directing people to IDA. They're handling 100% of the administration of the program.
Thanks, Chair Renahan. Excuse me. So I was wondering, this water program, the water bill assistance program, now, are you guys taking those calls here at 421 building, or is that being funneled through someone? Because I know I put a message out
Mhm.
about it, and I just wondering if you were getting many calls on that, or?
Well, we are currently assisting with water bills through the CSVG program.
Okay.
So we're waiting on this larger fund to really roll something out to all the water providers. We have talked with Public Works. We've also been in contact with the Wheaton Sanitary District, just making sure that the water providers know that they can direct individuals who are behind on their bills to us.
Okay. Great.
We have significantly limited resources right now for water bills.
Right.
We're doing it through CSVG. Once we have the full program, we'll absolutely roll out to all of the water providers.
Yeah, that'll be great too, I think, because, you know, like you need heat and air,
Right.
air in the summer, but you also need water. Like there's
Right.
a few basic elements, water is one of them. So I think that's really great that service that we'll be providing. And also you mentioned your social media. So you guys have been really knocking it out of the park on your social media.
Thank you.
So I've been trying to like and share it, you know,
Thank
when I see something, but you guys are doing a great job with your, with the rental assist. I mean, that's where I saw the water bill assistance so really nice job.
Yeah, we're also really proud. We've started doing some Facebook Live events,
Mhm.
specifically with our ombudsman program. And those have been very, we've had over 1,000 views on those, which is great. I appreciate the comment. That really was, that was already going to be an effort in 2020, was to kind of beef up our social media presence. Obviously with, the lack of ability to get out to community events, that was really, kind of our best opportunity to get information out. So yeah, we have Justine Chang does a great job putting all the information together. She puts a calendar out so that things are, kind of automatically released, and we're constantly reminding our managers, if you have information that you want to get out there, let's put it on the calendar. So thank you.
Yeah,
Yeah,
looks good.
I've been very pleased with our social media.
That's good. I'll second that. Anything you want to say about in terms of the tornado and some of the help that community services?
Sure. I thank you for mentioning that. I want to thank the community services staff who worked that weekend at the MARC event. I know that there were over 1,000 folks who came through. We buy gift cards with our CSVG funds as well as our DSSA funds, which is that's the sort of private charitable fund those funds basically come from community services staff who make donations, or we do our, the chili cook-off that we would have. So those funds are flexible, and we can, one of the things we do is buy gift cards with those. They went through every gift card that we had at the office, and actually want to thank procurement and the treasurer's office for helping us secure more gift cards that Monday so we could get them out to the folks in need. So our staff did a great job being out there assisting residents. So thanks for that.
Yeah, no, and I thank you. I know myself and member DeSart were out at that MARC, I don't know if you want to call it an event, but assistance. And it was, as I mentioned, JPS. I mean, really, what a great effort. I mean, people were getting things from, anything from food to shovels to how to get the tree taken down and put away, and just fantastic. So I thank you for your work, community services. Any questions for Mary, the committee? Okay, thanks.
Thank you.
Any old business? Well, I just want to say once again, welcome back, Member Solomon. We are so happy to see you. So, I'll mention that. Any new business? Okay, we'll take a motion to adjourn.
So moved.
Second.
All right, roll call.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
Member Chaplin.
Aye.
Member Desart. Chair Renahan.
Aye. All right, thank you all.
When is your next meeting?